charge people a license sticker fee because the $1.1 billion can be better spent on providing mental health services for people. I'm the only MPP in the entire legislature who voted against that.
Hey, welcome to News You Can Use. I'm your host, Brandon Gomez. Ontario is just 2 months away from an election where voters will decide if they want more of Doug Ford or potentially someone else. Well, the Green Party is hoping people will look their way as they've released a mental health platform, a first for a political party in the province, and something they're calling a game changer. Now, before I get into those details, I do need you to do a few things like subscribing to this channel, tapping that notification bell, and make sure to follow us on all of our social media. The details are in the description below, and don't forget to smash that like button. All right, currently, 1 in 4 Ontarians are seeking help for their mental health needs according to CAMH, but far too many people are not able to access support. That's why the Green Party is proposing increasing mental health spending, expanding access to OHIP, and even creating a dedicated 3-digit response line so people don't have to call 911 if they're dealing with a mental health emergency. Ontario Green Party leader Mike Schreiner is here to spill the tea on their platform, so let's bring him in. Mike Schreiner, leader of the Ontario Green Party, thanks so much for joining me here on News You Can Use.
Hey, it's my pleasure.
All right, I want to get right into it because the Green Party has been making waves over the course of the last 2 weeks with some policy that they want to see implemented, including the first ever mental health platform released by a political party in this province. Talk to me, why was that so important for you guys?
Well, I mean, first of all, everything is not okay, especially when it comes to people's mental health. Pre-pandemic, there were huge wait times to access mental health services and supports, especially for young people. 28,000 young people on a wait list that on average is, 18 months. It can be as long as 2.5 years. Almost half of Ontarians can't access mental health services and supports. And when they are able to access them, they're simply unaffordable. And so we're calling for increased funding to expand mental health services available through OHIP. When people show up, let's say in an emergency room, needing access to mental health care, and they're told they have to wait months to access that. It's unacceptable. The Ontario Greens are going to fix it.
I want to talk about some of the highlights of the platform that you talked about because you're looking for increased mental health and addiction spending, upwards of 10% of the health budget. So how much money are we talking about in terms of dollars?
Yeah, it's a $6.5 billion plan over 4 years. Interestingly enough, most of the funding would come from us reversing Doug Ford's election gimmick to remove license plate sticker fees, which is going to cost the provincial treasury $1.1 billion.
So you want that put back in place?
We want that back. We want to say, hey, you know what? Charge people a license sticker fee because the $1.1 billion can be better spent on providing mental health services for people. I'm the only MPP in the entire legislature who voted against that.
So that's 1.1 billion though. There's still about a $5 billion gap.
Oh,
there.
no, sorry. It's a 6.5 billion over 4 years. So on a per year basis, it's substantially less than that. So we're going to take the $500 million a year that the federal government says they're going to put into mental health services, combined with the $1.1 billion by reversing the license sticker fees, and that would fully fund our plan.
100%. What in the plan is going to address, help for especially communities of color like Indigenous communities and Black communities where sometimes there's a stigma about accessing mental health, or sometimes there are not the proper supports where the professionals actually understand the cultural differences of communities of color. Is there anything in your plan targeting that?
Yeah, absolutely. So the plan specifically talks about funding Indigenous-led mental health organizations, funding things like healing gardens and healing centers for Indigenous peoples, providing funding for Black, people of color, other cultural communities, 2SL, LGBTQ+ communities, because we know that a one-size-fits-all approach to delivering mental health services doesn't work for all communities. It's making sure that we fund those community-based organizations that are embedded in Black communities, Indigenous communities, and other culturally diverse communities.
All right, I want to talk about another policy that you proposed that gained a lot of steam, which was asking Doug Ford to cut transit fares across Ontario by 50% for the next 3 months. What was the reception that you got from that from people from the other political parties in Ontario's legislature?
Yeah, unfortunately, we haven't had much of a response from the other political parties, which really surprises me because, right now the cost of living is going up for people. It's putting inflation's putting huge pressure on family budgets. And an immediate thing we can do is to help those families deal with the rising cost of living, especially at the gas pumps, is to make transit more affordable for people. Making those transit fares affordable not only helps with the rising cost of living, but it also will help get more people back onto our transit systems, which will help alleviate the pressure that so many municipalities are facing with their budgets, especially because of declining ridership. Most of the financial supports that the government is looking at for families is all targeted to automobile drivers. Why not make some money available to people who can't afford to own a car, and by making transit more affordable for them?
But your plan proposal is for 3 months. Do you think this should just be something that is there forever? I mean, there has also been some advocates that we've heard call for public transit to be ultimately free for anyone who wants to use it. Where do you stand on that?
Yeah, so I see this as really a first step to significantly lowering transit fares. A 3-month pilot project gives us an opportunity to assess how effective this particular policy tool is to encouraging transit ridership. In addition to this, the Ontario Greens Climate Plan proposes that the province cover 50% of the operating costs of municipal transit systems across the province. And that is specifically designed to accomplish 2 things. One, ensure that transit service is expanded, is available, is reliable for people, and 2, to keep fares low.
Mike Schreiner, as we get closer to the election, we are planning on inviting all of the leaders of each of the parties back onto the show. Can we have your commitment that you'll be joining us?
Absolutely. I'd be happy to join you anytime. And can I make one more important point, I think, of our mental health strategy? And that is we're the first party to call for a 3-digit crisis line where people who are facing a mental health crisis, instead of calling the police, would actually call a 3-digit line that would go to mental health providers. And we'd have a mental health response, not a criminal justice response to people facing a mental health or addiction crisis.
Okay, thanks so much for adding that point. I did not know that was in the plan, so I appreciate you bringing that up.
Thank you so much. It's been fantastic to join you today.
Alrighty, we'll chat soon. Thanks so much.
Hey BG Squad, thanks so much for checking out our channel. And listen to this, we have more great content for you, like this video right here and this video right here. By the way, don't forget to subscribe to this channel right now and tap that notification bell.